21st century medicine is advancing at a blinding pace. But many doctors are the first to admit they don't have all the answers. For every modern miracle cure, there can also be a traditional home remedy, a herbal alternative, or an ancient therapy people swear by. Many of these treatments have been handed down the generations. But how many of them actually work?
Hello. Step into my office, Stevie.
Thank you.
I'm Jan Fran.
Why do you think it works?
And in this new series, we meet the everyday Australians who claim their homespun health cures work miracles.
What do you got? Plain yogurt or dandruff?
It is hemp kombucha.
Breastfeeding enhancing smoothie.
The most promising treatments will be scientifically trialled by an independent research team.
All right, good luck.
Thank you so much.
But first, they have to convince our team of medical experts.
This could be life-changing for the health of Australians.
Journalist and doctor Ginny Mansberg,
I'm trying to fight my science brain, I really am.
medical research specialist Professor Ash Hake,
I just have to make a confession. I'm a convert.
and groundbreaking neurosurgeon Dr. Charlie Teo.
Everyone thinks of medicine as being black and white, that we have the answers to everything. It's not true. In fact, many of these alternative treatments may be the answer that we've been searching for decades.
It cures a cough and it's a beer.
Yeah.
With diverse remedies
I'm a laughter researcher.
I make my own deodorant.
I believe I've discovered a cure for baldness.
Boldness?
Yeah.
from the traditional
My grandfather passed down to my father, and I was passing on to me.
This is a Peruvian smell. You probably feel
I've
that.
smelled that before.
to the controversial.
Drink it and you should be cured.
Cured.
Cured. This saved my vagina.
You're what?
And extreme.
It's maggot tea.
No.
No way is that going up mud.
Oh my God.
The pressure is on to decide
That tastes great.
which treatments are worthy of a real-world scientific trial.
Asha, I'm going to completely disagree with you here. I think this is everything that this show is about.
This is Medicine or Myth. Under close examination this week, a golden treatment for an infection.
The remedy is, can you guess?
I'm afraid to guess.
It's my own urine.
Oh my God. There it is.
While this little berry might be a godsend for women, men need to avoid it.
One little squirt of it and that was the end of his libido.
No.
You got the night to yourself, mate.
And does the humble fig tree hold the cure for warts?
You'll notice the wart gets disappearing before your eyes.
Amazing.
But first, a remedy that comes from the bush. And it's for one of Australia's most common chronic diseases.
My name is Diana and my remedy is blackberry leaf mouthwash for gingivitis.
Diana discovered it when her family left city life behind and opted for a tree change.
When we arrived at the property, we discovered that we had a pest on the property, which was the blackberry bushes in our waterways. These here are the blackberry bushes in our seasonal creek. There's no way of getting rid of them that wasn't to do with any toxicity, so we tried to look at what else can we do with them. During my research, I discovered that people have been using it for thousands of years for cuts and wounds and also for mouth ulcers. I was really excited that this could actually be something to help me with my bleeding gums and mouth pain.
Diana suffered from severe gingivitis, an inflammation of the gums which can ultimately lead to tooth loss.
When I started using the wild blackberry leaf as a mouthwash, I found that the bleeding stopped. I'm confident that it works for me, and it'd be really lovely to have someone else say, yes, this does work.
Will the panel agree to send a noxious weed to trial?
Hello.
Hi,
Welcome.
my name is Diana Kane and my cure is for gingivitis, and that's using blackberry leaf as a tea and a mouthwash.
2003, I discovered that I had gingivitis, and it kind of just went to town in my mouth, and it was bleeding spontaneously, where you could just be working on your laptop and it's just blood, and that's just not really pleasant.
Is that an extreme form of gingivitis?
Absolutely. Very few are as bad as you, where you're like just sitting there and boom. It's really a diabolical condition. Not only is it linked to gum recession and eventually losing your teeth, but it's actually linked to heart disease, to dementia, because apparently the bacteria that thrive in the gums during gingivitis are actually like a calling card to the rest of the body.
Gingivitis occurs when a film of plaque or bacteria accumulates around the base of the teeth, causing irritation, redness and swelling of the gums.
I tried everything that I possibly could that money could afford. I've gone to periodontal appointments and dentist quite frequently. And I found if I wasn't maintaining it, the gums themselves would weaken so much around my teeth that one day I'd be toothless.
So hang on, if my math is correct, for 13 years, you had severe gingivitis such that your gums were bleeding even spontaneously.
Yes.
How did you feel during that time, just having this terrible thing happening in your mouth?
Really awkward when you are sitting with new people.
And you're conscious of possible sort of bad breath, so
yeah, for sure. So you'd kind of look a bit awkward, wouldn't you?
Right.
That is probably the most depressing bit, because you don't want to be social.
So then you moved to your new place?
Myself and my partner purchased a farm, and within the stream area we've got all these blackberry bushes growing.
Blackberry was introduced to Australia from Britain in the early 1840s for its fruit and for hedges. It spread so quickly it was declared a noxious weed.
Did you feel like there was some fate in you landing up there with this weed?
Well, they say there's no mistakes in life, so perhaps it was waiting for me, absolutely. Would you like to try some?
Yes.
This is simply the leaves of blackberries. Nothing else in this?
Nothing else.
Thank you, darling.
Okay. Thank you very much, Dana.
That's great.
Bottoms up.
Cheers.
Bottoms up. Cheers.
I don't mind that.
Very palatable. Very nice.
You can taste the blackberry in it.
Yeah, it's quite fruity.
That is very nice.
It tastes pretty nice to me, but I'm struggling to overcome a little degree of scepticism.
And you should.
Maybe because we're considering trials and whether we should be testing things out now, I don't necessarily feel that this is the right one, but my colleagues here might be...
Dana,
Asha, I'm going to completely disagree with you here.
Ooh.
I think this is...
I'm just going to step back a little bit there.
I think this is...
Get out of the firing line.
I think this is everything that this show is about. We have a condition that is under-recognised with significant toll on your long-term health that a lot of people can't access adequate treatment for because it's too expensive. We have a weed that is not only free, but it's actually an endemic problem. We have it growing in Victoria, and people are actually using environmentally unfriendly methods to get rid of it, which we hate. And we have a problem that was fixed really quickly. We didn't need to wait 10 years to get the study results. This could be life-changing for the health of Australians. So I'm going to take the opposite stance to you.
I'm going to sit in the middle.
Oh.
Literally.
I want to pick it up and take it straight to trial tomorrow, because I think if this works, maybe we could stop poisoning the environment and getting rid of blackberries and cure oral health at the same time. I think we're onto a massive winner.
I must say that Ginny argues a very good point, and that is it has a public health issue here. There's no secondary gain here at all. You're not trying to do anything except try and help the world. I'm going to say we should run a trial, but with a slight amount of scepticism behind it. But nevertheless, such a compelling argument, I think we should take it to trial. So majority wins. It's Ginny and me versus poor old Ash here.
I hope to change your mind, Ash.
I'm open to that.
Can't wait to get you back. I hope we have some amazing results when we see the trial results. So thank you for coming and convincing my colleagues over
Thank you for having me, sir.
Our next remedy is not for the faint-hearted.
G'day, Jen.
Hey.
How are you?
I'm good. How are you?
Good to meet you.
You too.
What do you got?
I have placenta capsules.
Okay.
Yep.
Can I take a bit of a closer look at that?
Sure.
Oh, okay.
My name's Jen. I have 6 kids. I'm a birth doula. Rub your back. A doula is a birth support worker. I work with pregnant women and their families, and my remedy is placenta encapsulation for post-birth recovery. Being a birth doula, I had quite a few clients asking for their placentas to be encapsulated, and because I have a background in pharmacy, it was just a natural progression for me. Ingesting your placenta postnatally can help with energy and milk supply. It's quite recent development to put it into capsules. It just makes it more palatable. It's easier to swallow a tiny capsule than it is to actually eat your placenta. So I get the placenta and I rinse it. Then I slice it thinly and into the dehydrator for about 12 hours. And then I pop it into the grinder and grind it into a fine powder and put it into my capsule machine. There are 2 ways that people react when I tell them what I do. They either go, ew, or they go, oh, tell me more about it. I think that trials would be amazing. I mean, if I can do 6 kids and still feel great, then I want other women to experience that too.
Hi.
Hello.
I'm Jen. I've been a birth doula for 6 years, so I support women and families while they have babies.
Oh, okay.
I also encapsulate placentas, and these are placenta capsules. Oh. You know placentas? Yeah.
I know the placenta.
You with me?
Yeah. So that's not a placenta there,
Yes,
though.
that is a placenta in capsules.
Dried,
Correct.
processed, put into capsules.
Correct.
Someone's placenta.
Yes.
Not yours.
That is mine, yes.
Oh,
Yep.
when did you do that?
I had a baby 15 months ago, and so this is the capsules from that placenta.
While it's common for animals to eat their placenta, women consuming their placentas after birth is still considered rare and was first scientifically documented in the 1970s.
What did it do for you when you took it?
For me, it helped increase and bring in my milk supply. Because placentas are full of nutrients and hormones, it sort of replenishes what you lose after birth. So I found that it gave me more energy.
Look, I don't know about you guys, but I'm still... Sorry, we just need to take it back a step again.
Yeah, go for it.
Why would anyone want to eat the placenta? I mean, how did... I don't understand. I'm just, completely...
You need a moment?
Yeah,
just take a breath.
Because when I did OB-GYN as a medical student, we used to throw the placenta into a bin.
Yeah, I know.
When did people start collecting the placenta and examining it?
In the East, they've been using placenta in medicine for centuries.
Okay.
Human placenta?
Yes.
Can I just ask, is a placenta more nutritious than a steak?
Well, it also contains hormones.
Okay,
Yeah.
right.
I thought the predominant hormone in it was estrogen. So in theory, that would actually suppress breastfeeding, not enhance it.
It does enhance the milk, so it did me, and loads of people have said that it does enhance their milk supply. I imagine it's the iron content and the B6 that's in the placenta. It's sort of replenishing the vitamins that way.
Have you tried taking it differently, Jen, where, you are most tired immediately after the delivery?
Yep.
Why didn't you take the bulk of the placenta immediately
Like
after?
in a smoothie or something?
Absolutely.
Not for me.
Other people do that?
A lot of women do
Gee,
that.
I'm surprised.
Yeah.
Because it looks so delicious
I know,
right
right?
there.
But there are quite a few women out there that will do that, yep.
This has been a thing for a while.
Yeah.
And when I first read about this, I thought, look, it's got to be chock full of iron because it's an organ.
Exactly.
But I did see one study that did compare women who ate their placenta with women who didn't eat their placenta, and it didn't seem to make any statistical difference. So I'm thinking that there's something else here that spiritually connects you.
No, I think, definitely it would have a spiritual sort of effect.
Maybe it's an intensely personal thing where this may work for some women, not others.
It's not for everyone. I totally agree with that.
Because it's a tough time.
Absolutely.
Postnatal anxiety and depression.
Yeah.
is an enormous problem.
Yep.
I'm just wondering how having this little connectedness to your pregnancy could somehow combat that in a way that transcends the physical nutrients in it. And I think anything that helps you emotionally is a good thing, so I kind of like it.
Yeah.
On the other hand, I would never want to recommend something in which we don't know the process to make sure that we don't have bacteria in the placenta, that it's being done in sterile conditions.
That's why it really does need to be regulated.
I must say that to summarise, I don't think you're going to get much pickup from the general population, and I'm not quite sure it would be a suitable trial.
But I love that you've come in and shared such an interesting perspective on this really important time.
Awesome. Thanks for having me.
Well, thank you very much. It's
Thank
lovely.
you, guys.
Okay.
Thanks,
Bye.
Jen.
Can't see what those agents were within it that could have afforded any real benefit.
It's an amazing organ. I mean, it's the lifeblood of the baby. Without a placenta, the baby can't do well. I think we should celebrate it, but if it's full of estrogen, it's certainly not going to enhance lactation or breastfeeding.
It's going to impede it. And if it's full of iron, though, it could make you feel better.
Except that studies that have actually been done on that
Showed
don't.
that, okay.
Yeah.
The health benefits of consuming one's own encapsulated placenta have not been officially investigated by health authorities. Ingesting your own placenta is done so at your own risk. Our next remedy comes straight from the West Australian bush and from thousands of years of wisdom passed down the generations.
Hi, my name is George and I'm from this area, Binjarra, which is part of the Noongar Nation, and I'm a traditional owner. My remedy is the sap from the marri tree. Marri is another word for blood, so it's the blood oozing from a wound, if you like. It is a traditional Aboriginal medicine and is used for colds and flus. I learned about the remedy from my grandfather's generation when you go walking through the bush and they show you things. Little bobtail. We call it yorda and used to eat these as well. I look at the bush area as a big food bowl. Say okay, just saying hello. And a pharmacy. This sap is like an antibiotic. It works on throat area, chest area. I can't say that it tastes sweet, but, you know, medicines are not meant to be yummy, yummy, yummy. It's more yucky, yucky, yucky.
George is hopeful his cultural bush remedy will inspire the panel to study it further.
Welcome.
How are you? My name is George. I am a Noongar Aboriginal person from Western Australia. Because I'm on another nation's land and country, I would like to just acknowledge that I'm on the Eora people's land, this part of Sydney.
That's lovely, thank you.
I would like to talk to you about the marri sap.
Excellent.
The marri sap is literally that, the sap of a tree, and we use it for a bush medicine, and the bush medicine helps us with colds and flus.
I presume it has a scent?
It has not much of a scent, but it's got an interesting taste. So let's have a little taste of it.
Absolutely.
It's like a lozenge that swirls around in your mouth, and it gives you this protection. It is antibacterial.
It tastes a little bit bitter, did it?
It does, yes.
Yeah, and it's almost dehydrating to the mouth.
Yeah.
Like, I hate to be the devil's advocate here, but most colds and flus clear up after a few days anyway.
Yep.
How do you know that this is having a beneficial effect?
This has worked for me. And over thousands of years, the anecdotal is a science within itself, you know, from a culture on this land.
So I'm going to ask what I think is the really obvious question, is that colds and flus are viruses. You've talked about this being antibacterial, but in fact, that shouldn't have an effect at all against a cold and flu. So does it have antivirus properties as well?
It's got an anti-inflammatory property.
I think there have been some efforts to understand what it might be in the sap that could have some benefit. My understanding is that there are molecules called flavonoids. They're sort of organic molecules. These may have some sort of antibacterial properties.
Flavonoids are abundant in plants and are reported to have antioxidant and anti-inflammatory health effects.
Maybe flavonoids could be the reason.
Yeah. Well, very interesting, but I'm not quite sure it can go to trial yet. We'd like to do some more research on this, especially from Ash's point of view as a scientist. I would really like to know the active component of something like this.
I'd want to know whether there were any side effects that we don't know about before we sort of introduced it to everybody. I think there are a lot of allergies to some of these tree resins and gums.
No, that's great, George. Thank you very much.
My pleasure, and thank you again.
The red sap from the marri tree contains tannins, which have antiseptic qualities used by some Indigenous people to treat wounds. Coming up.
So you make up one batch and then I just shape it into a bullet.
Here's where I'm really struggling, because I'm looking at that and going, no way is that going up a fanny.
Earlier, Diana's blackberry leaf mouthwash was given a big thumbs up from Ginny for a trial.
I think this is everything that this show is about. I want to pick it up and take it straight to trial tomorrow.
To put each remedy to the test, we've enlisted an independent scientific team to conduct clinical research, collecting data from carefully selected patients who can trial the remedy. Each study runs for up to 12 weeks, depending on the remedy, and participants are selected from across Australia. Here are some who have volunteered to test Diana's blackberry mouthwash.
I've got my home remedy pack.
Project manager Simon has suffered with gingivitis for 3 years.
At the beginning of the year, I had quite major gingivitis. Painful during brushing teeth. There was a lot of blood, so it was rather uncomfortable.
Since having dental surgery, 60-year-old Victoria has been struggling to control her symptoms of gingivitis.
It feels like I've got little lumps in the upper part of my mouth. So this is where I have the problem, especially here along the front of my teeth. It's really quite embarrassing.
Retiree Philip has had little success in the treatment of his gingivitis.
I would think I've had mild gingivitis for maybe 10 years. I don't think there's anything more I can do to treat it currently than I have been doing.
For 7 days, each person testing will gargle twice daily after brushing their teeth, recording any changes in their symptoms. With study results still unknown, early indications of success are mixed.
Your mouth feels quite refreshed after gargling, and it gets all into all the gaps between the teeth, which is good.
I did notice one area of my gums seemed less sensitive, but if there is a change, it's very small.
Tastes a lot better. My husband says it's a lot more kissable. I'm day 3 in and I've noticed that the redness is coming back, and I'm starting to wonder if this is going to work.
We'll have the final result later in the program.
Hi, I'm Kate. I'm 38 years old. I live in a beautiful part of the world in Tasmania, and I'm so excited to be sharing with you a natural remedy to treat thrush. I call it the Fanny Thrush Bomb, and God. In 2015, my family and I moved from the inner suburbs of Sydney to a lovely spot half an hour outside of Hobart. I started getting a little itch, twinge, tickle in my lady garden, and it was bloody inconvenient to get to a pharmacy, I'll be perfectly honest. So I thought there must be an oily remedy for that, and of course there is.
Kate, hello.
Jan, nice to see you.
Nice to see you. What is this?
This is my Fanny Thrush Bomb.
Okay, I wasn't expecting you to say that.
What were you expecting?
I don't know what I was expecting.
It's a very, very simple natural remedy for thrush. And
Can I have a look at it?
Yeah, of
Is that-
course.
yeah?
So these are a little bit soft.
They haven't been anywhere, have they?
No. I have them nice and frozen. I leave them in the freezer.
Oh, okay.
So this little bomb is enough for four mornings, 4 treatment.
Oh, that smells delicious.
Good morning.
Hi, I'm Kate.
Hi, Kate.
And I'm here to talk to you this morning about my fanny thrush bomb.
Sorry, your what?
My fanny thrush bomb. It's quite shocking. See, this is a good...
It is shocking.
It's
shocking, yeah.
But why is it
Next.
shocking? You know, Lady Garden Health, I think, is a important...
Lady Garden. Okay, fine.
Important
So
thing.
we're talking about thrush of the vagina?
Yes, correct.
And a bomb being some sort of explosion.
Well, it's a subtle explosion.
Subtle explosion,
Yeah.
okay.
Vaginal thrush is a fungal infection caused by an overgrowth of yeast known as candida. 75% of women will have it in their lifetime, and symptoms include itching, burning, swelling, a discharge and redness.
Okay, so how did you come across this remedy for thrush?
I just had a baby and I was at home with 3 children and my husband was away travelling, and we live a little bit of a distance from a pharmacy, and I just needed to get onto it quickly. So I have heard of the natural remedy with yoghurt, and I've used that before, but I found it really quite messy.
Thrush is usually treated with over-the-counter medications. The most well-known alternative has been yoghurt, although there's no evidence it actually works.
This is a very tidy, very easy to apply remedy, and it's very convenient, and that's what I love about it. It's just 3 ingredients: coconut oil, lavender essential oil and tea tree.
And how did you come up with those essential oils?
Just did a little bit of reading. Tea tree has lovely antibacterial and antimicrobial properties.
You do understand that thrush is not a bacteria, though.
I do understand that, but it is a very powerful oil when it comes to healing. So the 3 of them combine together, and then I just shape it into a bullet.
Here's where I'm really struggling, because I'm looking at that and going, no way is that going up a fanny.
Totally. This is a full treatment that I do over 4 mornings. So you make up 1 batch, shape it like this, and then I put it into the freezer.
Oh, nice.
And then I just cut it up like 2 centimetres. In she goes, into the bathroom. I put my legs up in the air and just make it as relaxing as possible.
Can you show me the size of what's going up the fanny before I kind of get comfortable with
Yeah,
this? 'Cause
absolutely.
it's much wider than a tampon.
There's a couple that I have made, and they all do kind of vary in sizes.
These are just for you, though. Do you actually sell them?
Oh, no, I just make them for me.
So why have you got different sizes?
Because I'm a bit, haphazard when it comes to the making. Do you want to have a...
Oh, yes, please.
Oh, okay.
Not that I want it to necessarily melt in my hand. Oh, it's nice and cool.
It would be much colder. I keep them in the freezer.
It smells so
Lavender.
beautiful. Okay,
Yeah, you can smell
seriously,
it.
Yeah.
come on.
Lavender.
You need to get up close and personal with a fanny bomb, I think.
Yeah, I love the smell of lavender.
It's beautiful. It's very calming as well.
Okay, it smells nice. I want to play devil's advocate
Yeah,
at this point,
do.
because although we know that there's evidence of antimicrobial properties for tea tree oil and also for coconut oil, and I do wonder whether just having a bit of me time with your legs up in the air in the bathroom might be some of the therapeutic effect itself.
That generally works for you when you've got thrush, Ash? You like a bit of me time?
Absolutely no comment on that one.
I reckon, he's clearly never had it, right?
No.
How do you know that it's that's effective and not the passage of time? I mean, it gets better immediately, does it?
By the afternoon, my symptoms of the itching and the heat has significantly dissipated, and within 2 days...
Within 2 days, all the plaques, all those white plaques have disappeared.
Yes.
I'm intrigued about the chemistry of your bomb. So what we know is we need to restore the vagina to an acid environment. And in fact, the vagina's super acidic. It's got a pH of 3.8, which is not dissimilar to an orange. I mean, it's really quite acidic. So do we have any clue what the pH of coconut oil is?
No, I don't have any idea on that.
My gut feeling is that this is not changing the pH so much as the antimicrobial effect of this. It's working. Okay, look, our job is to assess whether these remedies are worthy of a trial. My feeling is that it isn't.
Okay.
Not for bad reasons, but for good reasons. We know the medicinal qualities of all those oils. We know that some people are more susceptible than others, and so there's going to be many variables. What do you think, Ginny?
Oh, look, I'm a bit devastated because I love this and I'd love to see some more science behind it, just to give women another option that doesn't involve going to a pharmacy. But I completely get where you're coming from, it sounds plausible, it sounds good. I think women could definitely make this as home, as long as they're making it in really nice, sterile conditions.
Yeah, great.
Ash?
Yeah, I think that there's enough evidence, suggestive evidence in the scientific literature that coconut oil has some antimicrobial properties, as does the tea tree oil. So I'm really with you, Charlie, and you, Ginny, on this. It's probably not the sort of thing we want to take.
We do appreciate you coming and sharing such a personal story. Thank you very much.
Thanks so much.
Lovely.
Thank you. Just take my lady garden.
Oh, and what a beautiful lady garden you have too.
Thank you.
While thrush is more common for women, men can also suffer from thrush around the head of the penis. Our next remedy could be the answer to annihilating a very common problem.
G'day, Diane.
Hi, Jan.
How are you? Good to meet you.
Good to meet you too.
I see. This appears to be a fig
It's
branch?
a fig branch,
Okay.
yes, and it's part of the cure that I'm presenting today. I did some research online and heard about fig milk. Supposedly that is an ancient treatment used by Middle Easterns to cure warts. Totally natural, available.
Yeah, don't worry about pharmacies, mate, just duck into your backyard.
Diane's hoping her remedy will impress the panel enough for a trial.
Hello.
Hi everyone. My name's Diane and my remedy today is fig leaf milk for the treatment of warts.
Whoa.
I like it. Tell us a little bit about it, Diane.
Well, I'm a mum of two and my kids love swimming. Over the years, they have developed warts on the soles of their feet.
Plantar warts are caused by a virus entering the soles of the feet through cuts or cracked skin. They also thrive in warm, moist conditions. Treatments include applying peeling acid, freezing, or surgical removal.
The natural course of action for us was to take our kids to the doctors, and as expected, they used a nitrogen freezing treatment on the soles of my poor son's feet. Over the next few days, my son's skin blistered terribly.
One of the things that I hate about taking warts off kids is it really hurts them.
That is a recognised complication of the procedure.
Absolutely, and we are always in that sort of difficult territory because if we can just spray it a little bit longer, it's better, but the risk is the blisters.
That? Okay.
So within 2 to 3 weeks' time, we saw little seeds of regrowth.
What we do know about warts is that what you see is like the tip of the iceberg that sunk the Titanic, and most of the iceberg actually is below the surface. And what you're seeing when the wart comes back is that more of it is moving up. So you never got rid of the wart. That's why we need to keep reapplying the cryotherapy.
Given what my son had been through and the pain, I thought, no way, we're not doing that to him again. So I did a bit of research on the internet. Fig leaf milk came up as a potential cure for warts, and having a tree lean over my fence from the neighbour's yard, I have here a branch.
That you pilfered from your neighbour?
With permission. You'll notice that there are no leaves on this branch at the minute, being quite cold. In summer, you can pick the leaves and extract the milk. In winter, you can pick a branch. There's more than enough milk in the branch. And if there's fruit, even better, there's heaps of sap in the stem.
So how much do you need to put on?
Depending on the size of a wart, 1 drop is more than enough.
How often? Once a day or?
You can do it once a day. It might take 3 weeks, but if you're doing it 3 times a day, as I did, the warts will be gone in 2 weeks or less.
But you've only done it once.
Only once, and the warts haven't returned.
What would happen if you thought it was a wart, but in fact it wasn't? So if I got you to put it on my hand right now, I'd be okay because I'm gloriously wart-free.
But I've heard that that actually the sap can be an irritant.
Of course it should be. I mean, if it's going to kill a wart.
You know, it can cause dermatitis is what I've read.
We wouldn't mind a demo if you don't mind.
Yeah, sure. So there you go.
Wow.
Look at that.
And there's
You
quite a
haven't
lot.
even had to squeeze it.
No, it's just coming out. You want some of that
Oh, yeah,
on your
why
skin?
not?
And that's what you
That's
don't
all
rub
you
it
do,
in?
just one drop like that.
Just 1 drop, and you'll find that the wart will instantly absorb.
And what happens after the subsequent few minutes? Does it continue to change in any way?
The colour will darken to more of your own skin colour. You will notice differences in the wart, almost like it's disappearing before your eyes.
Amazing. I mean, this is the sort of perfect remedy for the kind of trial we're looking for, isn't it? I mean, as a doctor and a mum, I think anything that can cure what is a pretty ubiquitous condition for children in a way that's not painful has got to be a massive winner, guys.
I think this is an intriguing story, and well, it certainly piques our interest.
I love it because it's simple. It's very specific. It's not as if we treat it that successfully. It's certainly very interesting, and we do appreciate you coming in and showing this. I think we should go to a trial.
Thank you.
Thank you very much.
Thank you all.
Thank you.
Awesome. See you on the other side.
Thank you.
Warts are extremely common. It's estimated 25% of the population has a wart at any given time. Coming up, a controversial remedy challenges the experts.
She said to put your own urine into your eyes for eye infections, and it worked.
I tend to see it more as a sterile wash than anything else.
My understanding is that urine is not sterile.
And Diane's treatment for warts is put to the test.
Let's hope it's going to work.
Next to face the panel is Trudy. With an ancient remedy the modern world may struggle to embrace.
Hello?
Hello, my name is Trudy and I have a remedy for eye infections.
Okay, lovely. Let's hear it, Trudy.
The remedy is, can you guess?
Please, no.
I'm afraid to guess.
It's my own urine.
Oh my God, there it is.
I had very infected eyes. Both my eyes were infected about 5 years ago, and I had to keep wearing sunglasses because I was sensitive to the light. And I went to the doctor, got some antibiotic ointment. I used it and it didn't make any difference at all. So I remembered a very old remedy that a very old lady had told my mother about. She said to put your own urine into your eyes for eye infections, and it worked.
So you just took yourself off to the dunny.
Yes.
Got yourself a little cup.
Yes.
And then gave yourself a bit of a splash in the eye.
No, not like that. I did collect the urine, and I made sure I had clean hands.
Well, that's important.
I used this finger for this eye and this finger for that eye.
Some people would say you're taking the piss out of us.
Well, it truly worked.
And when you did it, was it particularly distasteful? I mean...
I didn't taste it.
Well, sometimes you do, though, you know that. You know,
Yeah.
it goes down your lacrimal
Yeah, but I
gland.
didn't taste
No?
it.
Did you pee a little bit first, clean out the...
Yes.
And then catch the middle bit?
Yes.
Yeah.
I was a bit scared it might sting my eyes, but it didn't.
So you tried antibiotics.
Yes, I did.
Presumably there's some other medications you could also try.
Yeah, well, it's not sounding like conjunctivitis, is it? You know, just the fact that your eyes were sensitive to the light. I'm just wondering if you had another condition in your eyes, which would explain why the antibiotics were a complete dead loss for you.
I went to the doctor and he had a look at my eyes.
Regardless, you had sore red eyes beforehand, bit of urine in the eye, and like, you're a new woman.
I tend to see it more as a sterile wash than anything else.
My understanding is that urine is not sterile. And my understanding is that the latest research finds that, like so many parts of the body that we previously thought had no bacteria in them, like breast milk and the insides of your lungs, they're chock full of bacteria, generally good bacteria that protect you. My theory is that it was going to get better anyway. I'd love to see if you got a rerun of this condition, whether you would get a similar rapid response, and my gut feeling is, no, you wouldn't.
We sound terribly sceptical here, and sorry about that.
Sorry,
But I know it did work.
You might have special urine, Trudy.
I must have.
Yeah.
It looks very golden to me.
Maybe if you get another sore somewhere else, you could use urine.
I do drink lots of water.
Have you shared this idea with any of your friends or relatives?
I have, but they won't use it.
I'm with them.
But they did see the results of my eyes.
Well, so our question, Trudy, is do we start a trial where we ask people to head off into the toilet and grab a jar and whack it in their eyes?
If it works.
Oh, yeah, I'm just feeling there won't be a huge number of volunteers for this trial.
It might be difficult to get that cohort together.
But you were very brave to come in here, Trudy.
Okay, thank you.
Thanks, Trudy.
That's funny, you're right. She just wiped it. She didn't really... It's not as if she got a container and squirted everything out of her.
I'm kind of putting this down to maybe a happy coincidence, but what a great story.
It was a golden moment, if you know what I mean.
Urine therapy dates back to the Middle Ages. It was considered to be an elixir, referred to as the gold of the blood. Earlier, we saw Diane present fig leaf sap for plantar warts.
You want some of that on your skin?
not?
Our experts were unanimous in their decision to send the remedy to trial.
Anything that can cure what is a pretty ubiquitous condition has got to be a massive winner, guys.
It certainly piques our interest.
I think we should go to a trial.
Our scientific team found a group suffering the emotional and physical discomfort of plantar warts. Here are some who volunteered to test Diane's fig leaf sap remedy.
So I have a plantar wart on the bottom of my foot. It's really painful.
Model Quinn has found the ailment affects both her career,
Working as I do on the catwalk, it's just excruciating pain.
and her health.
This little thing is like I have a nail that stopped me here and I cannot take it out. It's so bad, I'm actually walking on the side of my foot now, so I don't touch it. I don't touch it when I walk. It destroyed this side of my foot. It gives me calluses just because I'm trying to walk on this side or eventually this one, so I don't touch the middle of my foot. For my work, that's just not a good thing to have.
Lucy from Western Australia has experienced the discomfort of warts for years.
The plantar warts are on the bottom of my feet. They can be really painful and uncomfortable and a little bit itchy. This is the wart on my heel, and that's the top of it that you can see, but it must go down quite a way into here. If you imagine it's got roots, so that's why you can't just knock the top off it. Besides from how it feels, it doesn't look very nice. I would like to be rid of it.
On day one of the trial, each person testing will record the size of their wart. The participants will then need to apply fresh fig leaf sap twice daily, morning and evening, until the wart disappears, or for up to 3 weeks, whichever is sooner, recording the change in size throughout the trial. For Lucy, the trial is over before it has a chance to take effect.
It was getting very red and irritated and even, you might say, infected. So because of my reaction, I discontinued using it.
Yet for Quinn, the results are promising.
At this stage, it appears to be a little bit smaller in depth rather than with. So I think it's like eating, this one is eating away at it. So hopefully, let's hope it's gonna work. Yay.
We'll have the final result later in the program. Our next remedy is friend or foe, depending on your gender.
Melina, welcome.
Thank you.
Tell me, what's your remedy?
My remedy is chaste tree.
Did you say chaste tree?
Yeah, chaste tree. Well, chaste tree is a female hormone tonic, but originally it was called chaste tree because if men take it, it makes them chaste.
It'd be great if, you know, you wanted that outcome. You just drop a few of this into their regular tea.
Yeah, slow them down.
Yeah, you got the night to yourself, mate.
Hello.
Hello.
Hi, my name's Melina, and my remedy is chaste tree.
Chaste tree?
Oh, I know what this one's
You know about
for.
it?
Yeah.
Oh, great.
Well, I like women's health, but anyway, you tell us what you're using it for.
Anything to do with your menstrual cycle being not very good. So if you've got period pains, bloating, moodiness, hot flushes.
I guess it's putting you back into balance or something, isn't it?
Yeah, I think it's mainly progesteronic, so it kind of helps get the progesterone balance back up again.
Chaste, as in chaste?
Yeah, because it originally was used by monks in Europe to keep them chaste.
No.
Yeah, when I started taking it, it makes women more frisky. So when I started taking it, my husband, he's like, that stuff's great. She's so happy. She's never moody anymore. She's more amorous. I'm going to have some. So he took one little squirt of it, and that was the end of his libido.
Oh, my God.
Yeah.
When did he get it back? How long did it take?
Not long after, probably, you know. Like
Thank goodness.
Yeah.
So just looking at that jar for a moment, is it the seeds from the plant?
I've got the seeds, and I put them in a blender, or, you know, in the mortar and pestle, and I just bruise them a little bit and then just pour alcohol over them and soak them for 6 weeks. And then I drain that in a sieve and then have a little dropper bottle, and you just take a squirt a day.
Now, is this something that a personal story?
When I was 38, I started hot flushing, and so I started taking chaste tree then.
And how long did it take you before you realised
it's nearly instant chaste tree. Like within a week, you probably could not have a hot flush again. Depending on, you know, everyone would react differently to it, but for me, it was really quick.
It won't bring back your normal periods and keep you...
Yeah, it actually can. If you're kind of getting sporadic because you're imbalanced, then it's going to help put everything back in order, and you keep working, keep working in that way for a bit longer.
So the symptoms of perimenopause, it's not scientific, it's just this waxing and waning of your hormones.
Yeah.
I call it hormone hell because you just one day is different to the next. And some women get incredibly sore breasts and, almost can't move. Other women lose their libido. A lot of women get anxious. Some women can't sleep. Some women get hot flushes. Some women don't. Some women's periods just go to pot. Some women can have bad moods for 3 weeks out of the 4.
Yeah.
They say, I'm so mean to my kids, I'm so mean and angry all the time. And then they go and chaste tree, and that kind of gets better and better every month. This hormone hell is just a disaster, and we just don't have a lot to offer. I think these kinds of things are really popular, but I think the evidence is really growing around the chaste bearing.
Yeah. Hormone hell for you, it's husband hell for us. It does affect the entire family.
Yeah, definitely. And especially if you're saying I'm moody for 3 weeks of the month, that's a long time to be in a grumpy mood and taking it out on everyone around you.
I hear that probably 4 or 5 times a day. And to every woman I say, I wish you could sit in here with me all day, every day, because you would just not feel so alone.
Yeah, and even if only 1 in 5 got that, you just go, wow, isn't that fantastic that one woman has had this massive change in her life, that she's no longer having bad symptoms.
Fantastic. Thank you very much. It's really been enlightening for me.
It certainly piques our interest, but I'm not sure that we could really try it. What do you guys think?
It's not a trial type thing, I don't think. It's like you said, the studies have already been done. It's actually in science. Incredibly enlightening for us and our audience, Thank you very much.
Thanks, Melina. Thank you. See you later.
University studies have shown the use of chasteberry during menopause may reduce the severity of hot flushes after 8 weeks of treatment. Next, we'll find out if fig sap really does zap warts, and if blackberries are the new heroes of oral health. The time has come to reveal the results for the 2 remedies our panel chose to send to trial. Diane's fig leaf sap for plantar warts.
That's what you
That's all you do, just one drop like that.
One drop, you will notice differences in the wart, almost like it's disappearing before your eyes.
This is the sort of perfect remedy for the kind of trial we're looking for.
And Diana's blackberry leaf mouthwash for gingivitis.
When I started using the blackberry leaf as a mouthwash, the bleeding stopped.
This could be life-changing for the health of Australians.
First is Diane's remedy for plantar warts.
Look, you guys, unfortunately Diane couldn't be with us today, but you do recall that her remedy was the sap of a fig tree that could potentially treat plantar warts. This really interested me because I had plantar warts as a kid. The treatments that people recommended were incredibly long-winded. It was certainly very painful, so I was really interested in this as a potential treatment of plantar warts.
Okay, well, let's go through these results.
Okay, so unfortunately 3 out of 4 patients did not enjoy any benefit at all from the sap. 1 in 4, however, did. Not only did they experience a benefit in reduction in pain, reduction in the size of the wart, but 1 patient had the wart completely disappear once they instigated the treatment.
So I'm going to put my cynic's hat on and say that a wart is in fact a viral infection. And what we know from studies is that in 80% of cases, if you just leave them alone, they're going to get better on their own anyway. You know, we're not sure that the extra stuff that you're doing, given that any wart treatment can cause burning and irritation, which I think it did in this study, didn't it? Yeah. Is worth it, given that within 2 years, likely ta-ta wart. What do you reckon?
That was always a bit of a red flag for me. I mean, if we have a quick look at one of these branches here, as you can see, you know, running all the way through this white sap. It may well be that this sort of sap could cause irritation on any skin, right? Even when it's sort of misapplied on an area adjacent to the wart. So that was, as I said, a red flag, but maybe some efficacy in a small portion of the participants.
Yeah. Look, to be honest, from a scientific viewpoint, this one really didn't hit the target. 3 out of 4, no improvement at all. The figures are pretty convincing that it doesn't work.
Next is Diana to hear some home truths about her home remedy.
Hello.
Hi, how are you going?
Hi, Diana.
How are you?
I'm really well, Ash. How are you going?
Yeah, good.
I have to tell you, I was more excited about this than pretty much anything. I couldn't wait to get the results because this is a huge public health issue that we're dealing with here. It goes much beyond just having a bit of bleeding when you clean your teeth or even the horrors of losing your teeth. It does seem that the gingivitis seems to actually increase your risk of heart disease and stroke.
It's really quite disturbing as where it can lead on to from just having a bit of bad breath.
Okay, Diana, here we go.
Okay, I'm ready.
It's good and bad news.
Okay.
30% of people said they had improvement in their bad breath. A third of people said they had improvement in the redness of their gums. The rest of them had minimal improvement or no improvement.
For what we could achieve in 1 week, I thought that was mind-blowing. I would have thought that for the inflammation to settle down would take more than a week.
So we do need to strike a note of caution here. Although 33% of people noted some improvement, 10% noted no improvement at all.
Okay.
I'd like it to be effective. I mean, really, what a great way of reducing the incidence of this condition. I agree with Jen, it is encouraging.
Oh, absolutely. Not just encouraging, that's fantastic.
You're happy with that
right,
result?
5 days or a week.
1 week.
Which isn't even the 2 that I was recommending.
I'm with you. I'd like to see a longer trial, but as a first step, that potential is big for a very cheap, easily accessible weed to change the life of so many Australians and do it before they get to your stage.
Don't wait 15 years.
Right.
Good tip.
Diana, thank you very, very much.
Thank you. Thank you
Lovely.
so much.
Awesome.
Yeah.
Thank you.
Cheers. Bye.
Thanks, Diana.
What it means to me is that I can go and pick some more and put it out there and hopefully everybody gets to sample it and have their own opinion on it. And if it's working wonders, then I think it's just going to be a great healthy item for people to put in their cupboards.
Next time on Medicine or Myth, a tea that may cure acne.
Got a very special ingredient and I'll let you guess what's in it.
Cockroach.
and a natural solution for hot flushes.
We've all been looking for the great white cure for menopause.
And can sound heal depression and anxiety.
Feel like your blockage is here because you're an overthinker?
No.
This program provides general information only and does not recommend or endorse any particular treatment. It is not intended to replace the advice provided by your own doctor or medical or health professional.